Tree nursing intervention for a patient experiencing hemiparesis. What is hemiparesis?
Hemiparesis is a partial weakness of one side of the body. It can affect either the right or left side of the body. The weakness may involve the hands, arms, legs, and face. People who have hemiparesis are still able to move the side of the body with a limited strength.
Upper body dressing. Step 1. Introduce yourself and explain the procedure.
Good morning, ma'am. I am Jamie Narson, your nurse for today. And then, tulungan po kita magdamit.
Step 2. Perform hand hygiene. Step 3. Make sure that the clothes is clean and should be one size larger. Step 1. Put the shirt in the affected arm using the non-affected hand. In here, you can see that the patient is struggling on putting her shirt. So, to lessen the struggle of our patient, we can assist or help them to put on their shirt. Step 2. Insert the other side of the shirt using the unaffected hand. Step 3. Grab the neck of the shirt and ask the patient to tilt down her head to enter the shirt.
During this part of the skill test, it is important not to push, pull, or manipulate the patient.
Positioning of a stroke patient in a safety and comfortable. Step 1. Ensure that the patient is well rolled over onto her side. Step 2. Place a pillow under the weak arm of the patient to support. Step 3. Place a pillow under the weak leg to support.
We need to change the position of the patient regularly to minimize a risk of skin breakdown and contractures and chest complications.
In positioning the patient, it depends on how severe the patient stroke was and which part of the body were affected. Good positioning helps the patient to prevent more harm to their affected limbs and help to prevent future pain, and also it helps to maintain the normal range of motion in their muscle. How to help a stroke patient to walk using a cane.
Stroke can cause paralysis of one part of the body, and the patient may find difficult to walk.
Step 1. In walking the patient, always stand on the weaker side of the patient by placing our hands around the hips of the patient, or we can use a gait belt. Step 2. The height of the cane should be leveled of the wrist of the patient. Step 3. Move the cane with the weaker leg at the same time and be followed by the non-bearing foot evenly.